Well, it's good to have everybody with us today. One of the things that the My Radio show, Florida Daily, has been so, I guess, been successful is it's not always the norm where we cover a lot of business, we cover a lot of consumer news, scams, politics, but there's a lot of news with the Maha movement, a lot of news when it comes to. We're going to talk about China. A lot of news when it comes to your health care, when it comes to things, betterment, whatever. And I don't think we get a. I think people are looking more and for more from what they can hear from all sorts instead of just from the CDC and some of the quote experts. But I think a lot of people
Mhm.
love hearing other alternative, whatever you want to call it. We covered a lot here. I find it very informative. We find a lot about this as great consumer news. It gets a boatload of attention from the audience members. And that's what I want to talk about today. Dr. Roberta Shapiro, of course, is the chief medical officer at Cressell LLC. And where do we even start here, doctor? I want to talk about the Maha movement. I want to talk about China's rapid rise in drug development. Should that concern American leaders? There's a lot of stuff
Yes,
that's not being discussed today. Kick it off with what areas that we need to
yes,
be focused
yes,
more
yes.
on.
So China is a major issue for us. China has transformed in the last number of years from a generic drug manufacturer to a global biotech and regenerative medicine powerhouse. And that is being fueled by state subsidies within China and also streamlined clinical trials. So they get from trial to market a lot faster than we do. So their drugs are out for market very, very quickly, and we need to compete on a global level with this. So what Europe has started to do was they actually are fast tracking certain drugs to be able to compete with China, and the FDA is looking at fast tracking certain drugs as well. But China's not just looking at the drug market, they're also looking at the regenerative medicine, the longevity market, because they see, just like we have this MAHA movement in this country, which is all about anti-aging, longevity, biohacking,
Right.
eating well, exercising, all of the things that are actually good for us at the end of the day anyway. China's now jumping on top of that, and they are expanding their applications of regenerative therapies, particularly as it applies to different disease processes such as diabetes and skincare elements. So, for instance, we did a study on rosacea recently looking at a biobotanical. This is something that China is also developing, the world of biobotanicals, which means biologically active plant derived medications. So they're over the counter, they're easily accessible if they're made with the right proprietary microemulsion technology, and they're very, very effective. China is looking at this. We just did a study. We have a product already. The product that I represent, Crisel, that's an aloe and oat kernel oil cream, natural cream that completely regenerates the tissue and decreases the erythema and rosacea and outperform the standard of care prescription drugs. So these are the levels at which we can be competitive with China in this field. And we have to expand the natural technologies that we have access to.
Dr. Shapiro, are we behind on the eight ball of getting the products approved, or with your company? No, we're getting there. We're competing with them. Maybe I
So
just answered my own question. Are we behind in getting them the production or getting them approved here in the U.S.?
it's getting them approved and access. So basically, something like Crisel is a perfect example. It's over the counter, it's already available, but it's not being marketed for the different reasons that it could be useful for: rosacea, eczema, psoriasis, diabetic foot ulcers, wounds, burns, particularly helpful in the American population. You know, Florida has a very big VA population, and the VA population is very dense in diabetics, and diabetics have complications.
Yep.
So China has focused a lot on those complications that lead ultimately to wound care, diabetic foot ulcers, expensive treatments, ultimately amputations. So if we can prevent those things at the front end, the stage 1 and 2 ulcerations, we not only improve the quality of the veterans' lives, but we also save billions of dollars and we compete on a global market.
Dr. Shapiro, talk to me because your own research into regenerative medicine with Cressel and how it's showing that all natural, that's the key word, all natural solutions when it comes to your body's own healing power. You're not talking about this, you're talking about natural healings. I'm fascinated by
So
that. Explain to
I
me.
am talking about it's unbelievable. This basically for a product to be biobotanical, it has to be at a minimum of 5% concentration of that plant. So both the aloe is over 10%, the oat kernel oil is over 5%. They work together to create a microemulsion technology that absorbs all the way to the mitochondrial level, which is where the regeneration of tissue occurs. The mitochondria basically restore homeostasis. So whatever the pathology is, whether it's like rosacea, where I said you have excess blood flow, pathologic blood flow to the area, it actually diminishes the pathologic blood flow. This is a
Mm.
regenerative topical cream. In cases of ischemia, like the diabetic foot ulcers, it actually increases blood flow. So it's an intelligent therapeutic, and that's what regenerative therapeutics are all about. They should basically morph to adjust to whatever the pathophysiology is and create and restore the homeostasis that's necessary for regeneration of tissue. So it approaches it from two main ways: anti-inflammatory and regrow blood vessels, or angiogenesis. If you regrow blood vessels, you get healthy oxygen and nutrients to the area, and you create an environment that allows regeneration of tissue.
The
So
Maha move Go ahead. I was just gonna
sorry, no, sorry.
I got tons of this stuff to ask you. So the Maha
I,
growing demand for all natural cosmetic solutions, you're
mhm.
coming out with a product. Again, you're talking about all natural solutions out there. This has been different than the norm we've seen for the last many years,
Yes.
correct?
Yes, correct. It's not a synthetic, it's not a pharmaceutical, so there's no adverse events associated with this. All the studies we've done so far, all the applications, there have literally been zero adverse events, which I can't
Mm.
say about any synthetic pharmaceutical that I prescribe. There's always, you put a topical steroid on, there's always the possibility of skin irritation and a negative outcome from it. So anything you put on pharmaceutically has the potential for toxicity. Natural substances, when prepared properly, do not have any adverse events or toxicity. So it's exactly what people are demanding. I get patients in my office all the time. They want alternatives to the prescriptions that they've been given. They're all interested in this, particularly the young people. They don't want to end up with the disease processes that their parents have.
I was gonna ask you, what age group do you see, looking to get involved in this type of product more? I mean, what age groups do you see? Is it
Yes.
older, middle age, or younger Americans?
I have been surprised it's been every age group. So I have the older population who have skin dermatitises and different, manifestations of eczema or psoriasis. But I have young patients who are saying to me, will this prevent my wrinkles? Will this help me with discolorations? Will this help
Ah.
with rosacea? Will this help with, and they go through the same process of questions. But I get a lot of young people asking me because they are the most interested in their overall health, actually. They're the ones most interested, the 20 to 40-year range, right in there. Are
Mm.
the probably the biggest population of patients I get interested in alternatives and the Maha movement. All of them
How are they
asking me
getting
about.
informed about that? I mean, somebody my age, you're still young, of course, but how do they come across this? Is this because they're reading, they're going online? You would
They're
think young
online.
people would understand some of this.
Oh, they are so sophisticated in their knowledge. Some of them are more
Mm.
knowledgeable at biohacking than I am, and they teach me. So they go online and they're reading and they're listening to all of these different influencers who are doing the biohacking, who are doing EBO treatments or ozone therapies and plasmapheresis, all of these things that are geared towards anti-inflammatory and anti-aging, all of them.
Dr. Shapiro, are there people talk about alternative medicine. Are there enough of is there more? I understand with the age of technology is more out there than ever before, but is there more where it's like, does the total establishment just poo-poo on this type of stuff because they don't want something that may differ with them? Or, for example, if you're used to going down I-95 and there's a new bypass that says we go quicker, oh, but I'm used to going I-95. We totally avoid the bypass, the alternative route. Is
Mhm.
there a lot of more, a lot of this education, or are there groups out there that are like, well, it's good, but I mean, you have those
Yes.
naysayers out there.
So it's a mixed bag. It used to be very negative. I would get laughed at. I'm at Columbia University, very traditional university
Very
is my
popular
affiliation.
university.
Yeah,
Yes.
that's a very traditional affiliation. And I got a lot of pushback for a number of years because I've been in the medical field for 30 years, but in the regenerative medicine field for over 15. And so in the early days, I definitely got a lot of naysayers and a lot of negativity. Now I literally have doctors coming up to me and asking me for more information. I had the former head of neurosurgery from New York Hospital call me up a couple years ago after he retired and said, Roberta, you were right. All those years talking about and harping on regenerative medicine and all of these influences of natural therapeutics that you're talking about. You were right all along. We need to harness the power of these natural therapeutics for healing. And so that's the former head of neurosurgery at New York Hospital asking me that. So I'm seeing a lot more openness to these alternative therapies now.
Where does this
Um,
go from here?
where it goes, so I think the future actually is in the realm of biobotanicals as a first line therapy for disease processes. I
Mm,
think we're going to start learning much more about herbal therapies and medicinals that can treat severe disease processes. There's some interesting data coming out from Asia, unfortunately, around the world, but it is talking about the future of medicine, and it's absolutely preventative, anti-aging, biologically engineered, and natural supplements. That's the future. That's where we're headed. Everybody is interested in slowing down the aging process, and they're learning how to do it.
Dr. Shapiro, I'm always curious about timelines. And
Hmm.
when did the alternate, like with what you're doing, when did we start focusing or more people became more educated? Was it before COVID? Was it after COVID? Was it years
No,
earlier? Was there a defining line where some it just the bell
great.
and alternative health, which you're promoting as well, a lot of people are
Mhm.
embracing, people started picking up on it. How long ago
That
was
is such a great question because it literally it transitioned right with COVID.
it? Mm,
People were home, they were more interested in their health, they were focused, they were reading about health related entities, and they started researching. That was the entry into natural therapeutics to this extreme that we're seeing right now. That to me was also the beginning of the extreme Maha movement and natural tendencies. People asking me all the time. They used to ask me about stem cells. Now they're not asking, they're demanding that they want these treatments. And, Florida is so progressive with this. We are
yeah.
ahead of the country. It's amazing what we're able to do here now.
Well, Dr. Roberta Shapiro and her own research into regenerate. I mean, listen, as a news guy, I read about this all the
They're
time.
great.
And regenerative medicine with Cressell and how it's showing that all natural solutions. The reason why I was asking when was that curve, because I was thinking, okay, after COVID, we saw a lot of this really pick up. To your point,
Hmm.
people are home, they're reading, going, hey, maybe I don't need, whether you support it or not. I'm just saying maybe there's
Hmm.
something alternative to a
Right,
vaccine or
right,
something, I need better living.
right.
And I think a lot of people are picking up on that.
Yeah, absolutely. Absolutely. The movement, in my estimation, really began at that time in
Well,
earnest.
Chief Medical Officer with Cressell, Dr. Shapiro, I'm glad you came on with us today.
Thank you.
All right, and we will continue
Thank
all this
you.
conversation right here. All
And
right.
this has been such a pleasure. Thank you so
Oh, do
much.
it again.
I
Yeah,
can't, it's,
I
I
I
would love it. It's
I
great.
like the I like, because I'm pretty good at the interviews. Pat on my back, but I'm saying is I love the back and forth we had here. It was good, and we shall
I'd
certainly
love to
do it
talk
again.
more with you. I
We're
really
gonna do
would.
it again, and it's great
Thank
for this
you.
and on radio and stuff like that as well. All
Thank
right,
you. Thank you
right
so
here.
much. Okay. Take care.
Boom,
Bye
we're
bye.
good, and I'll get this ready to go, and then I'll get it to you on the edited part and everything else.
I'm ready to go.
All right. No, we just get done
Oh,
with the whole edit. We're done with
okay.
the recording, so what we'll do is I'll get it all
Okay.
edited and
Very
get it
good.
ready to go.
Ed, I
Um,
really appreciate it. Thank
dude,
you
we're
so
doing
much.
so
This was really,
shall
really a
do it
pleasure.
again. We'll do it again soon.
I'd love to talk to you about Florida and the VA and some of the things with that. I really would.
Listen, we cover VA. When I take calls on my show, because 'cause I'm so big, the VA gets all sorts pros and cons, and by the
Yeah.
way, we're in all these markets, like, I broadcast out of Jacksonville. We're in all of these markets where, again, it's a lot of military.